Hello, I'm Grant Diggles with Health Professionals Alliance, and you are watching The Real Doc Show, where we talk with real doctors about real topics and we spotlight real solutions. Now, if you're an independent practice or group out there, you want to protect your independence, you want to control your patient care, and you want to see yourself thrive in the market, HPA has a message for you. Don't get consolidated. Instead, join the HPA family with other independent practices and groups across the country in both medical and dental. Protect your independence, control your patient care, thrive in the market, and build your wealth. If you want to learn more about this exciting model that's growing across the country, we invite you to visit www.hpamembers.com. Now, my guest today, I'm very, very excited about, and we're going to be talking about a trifecta here because we're talking with a real doc, we're covering a real topic, and we're going to talk about real solutions all in the same show. So I'm very excited about this. So without further ado, let's get started. We're going to be talking with Dr. Kristen Bishop, based out of Mesa, Arizona. She has a cash-only private practice, and this has become a very hot topic across the country with doctors asking the questions, how do I have a practice? How do I thrive in the market without being dependent on insurance payers? So I met Kristen I knew I wanted to have Kristen on this show probably 6 months ago. When I first met her, she was a disruptor. She happens to be a doctor and a very good one at that, but she is also a market disruptor and entrepreneur. And I told her right when I first met her, I'm like, my gosh, I want to learn about your model. And then we have the Real Doc Show, and I knew I wanted Kristen on the show as quickly as possible. So I'm joining Kristen here now. Dr. Bishop, it is a pleasure to have you on the show. How are you doing this morning?
I'm doing awesome. Thanks for having me.
You bet. Well, I was not going to take no for an answer. So I'm glad I didn't have to strong arm you onto the show. But what you're doing right now in the market is it's still kind of a novel idea as far as I'm concerned. I've been talking with other doctors that have really been interested in expanding their practice and growing their practice without being dependent on insurance payers. But they struggle with understanding the concept and the steps involved and how do I make this happen? Like, how do I grow a practice if I'm insurance and then I transition over to cash? What does that look like? And so we may cover some of those things in this call today or in the show today, but one of the things I want to hear from you is why you decided to do it. But before we go to that question, would you mind just giving us a quick background on you and let everybody know who you are?
Sure. So I'm Dr. Kristen Bishop. I have been in practice for 10 years. We just had our 10-year anniversary this February, so about a month ago. Super exciting. Opened a second clinic also in November of this past year. So 2 clinics in the Phoenix area. It's going remarkably well. I have stayed true to primary care, which, a lot of you know that's sort of a dying breed. So love what I do with primary care. And I'm a naturopathic physician, so I kind of get the best of both worlds in that I can practice Western medicine as well as Eastern medicine. I have additional training in nutrition, homeopathy, acupuncture, and as well as pharmaceuticals and things like that. So it's kind of a good job I have going on here.
Well, the thing that's most interesting to me, so when you became a doctor and decided your path, what you were going to do, I'm going to open my own primary care practice. Did you, in the very beginning at all, deal with insurance, or did you immediately jump into, I'm going into cash pay and that's my route? Like, did you start with insurance and then go to cash, or was it just cash right off the bat?
No, I always stayed cash for a lot of reasons. One, privacy. When you pay cash, you your health information doesn't really go anywhere. So that's one huge benefit. And a lot of our patients appreciate that. And some of them realize it and some of them don't. But we do have people who search out cash pay just for the privacy issue. And then I just didn't want all of the red tape. When I was growing up, I was fortunate enough to have a family doctor who was an actual old German doctor who practiced out of his basement. And so that experience has I know it's pretty crazy. I still remember like walking in and we'd peek our head in the kitchen and say, "Hi, Mrs. Flockenhaus," and then head down the steps, and Dr. Flockenhaus would come out of one room and with a family, and the family would go up and we'd go in the room, and he had a couple couches with some magazines, but there was no check-in counter, no, insurance and driver's license, please. None of that, and he took care of my grandparents, their 8 children, and then us. And so the time wasn't spent, with him looking at his computer, trying to figure out who we were or what we were about. He didn't need to ask about family history because he knew it, right? He took care of generations of our family. And so I think that had a lot to do with shaping the kind of doctor that I wanted to be. And thankfully, I was able to hold true to some of those principles and make it happen.
Okay, so one of the things you mentioned was privacy, but I have had a conversation with you multiple prior to this show. And one of the interesting things that kind of popped out in our conversations was the nature of having a cash pay practice in the midst of a global pandemic. And, the things that we talked about is that, okay, it's about privacy. We get that. But what about the practice functionality as we went through this pandemic? Did you find that you were able to have more freedom in that environment where other doctors were like, "Oh, I can't take insurance." So, and then of course there was the vaccines and there's all kinds of stuff, right? So how do you feel your practice at Keystone was able to operate in the pandemic? Because it's a really good example of some of the freedoms that a cash pay practice can have all the time. And even when we're in a situation where it's like, oh, global pandemic, how much worse can it get? You still had options. So what was it like during, I guess we're post-pandemic, or coming out of it or whatever it is, but tell me about how Keystone was able to operate during the pandemic time.
So because we don't take insurance and we're not dictated by a lot of their rules, we were able to stay open the whole time. And we chose to do that as a team, which was great. We didn't close. We didn't really do anything that they were recommending that we do. We operated business as usual. We felt like, we signed up for this and this is, game on, right? So that was great. I think our model, the model that I use is called direct primary care, or DPC model. And it is across the country. I'm not unique in this model, but what that afforded me to do is, one, we had a record-breaking year during the pandemic. And I think that was for a few reasons. One is it's a membership-based model. And so people were still on our membership regardless. So it was sort of interesting in that as people sadly lost their jobs during the pandemic, a lot of our patients would tell them, "Hey, you just lost your job and then you lost your benefits. So you no longer have health insurance and you're in the middle of a pandemic. You don't really want to be without a doctor right now. So get to our doctor because she doesn't care about insurance anyway." And so we had a lot of people coming to us. And, people are so interesting, especially like the American spirit. I just love it, because another thing that came out of that is some of our small business owners then said, "Well, hey, we can't afford the premiums for insurance, but we don't want our employees without a doctor either." So they started paying for the membership for their employees to give them that peace of mind and some security during that super turbulent, anxiety-driven pandemic that we went through. So that was all really kind of interesting things that came out of it. And that was more consumer-driven and innovative by a need from the pandemic that we didn't even, see. So we had all kinds of people coming to us. I think looking back on the pandemic, and as we see some of the research coming out of the last 2 years, I think even public health has said that the mitigation strategies that they thought were going to work in the beginning were probably a very, very bad idea, meaning, people were going through drive-thrus, testing positive, calling their physician, and the doctor would say, "Well, you can't come in, you have COVID, go home, quarantine yourself." and people were literally dying in their basements, right? Because no one was checking on them. No one wanted to be around them. No one was putting a stethoscope on them. No one was checking their oxygen. Nobody was doing anything. So that has proven to be really a bad idea, which we all kind of knew going through. But that also brings me to the whole primary care piece, because it goes back to the story I started with. Like, Dr. Flackenhaus knew our family. It was so much easier for me to take care of our families through the pandemic. So what we did right away is we did some webinars with everybody. We said, here's what we want you to have on hand. Here's all the nutraceuticals you guys need: the vitamin D, the quercetin, the zinc, the elderberry, whatever. And then we had everybody get pulse oximeters so that if they were too sick to get in, we still could get their oxygen levels. We knew their history. We knew all of it. So just the way that we practice in knowing our patients, and, when you're on a membership, we don't charge you for phone calls. We don't charge you for telemedicine. So we just utilized all of it and took care of people however we needed to. And we told them all, don't wait. And so we had amazing outcomes through the pandemic, thankfully. And, it kind of showed how primary care is amazing, how the membership is amazing, because nobody was worried about, oh gosh, I can't afford to go see a doctor, because there's a lot of hesitancy, right? If I go to urgent care, what are they going to charge me? And now my kids are sick, and now we're up to 4 of us, and we're all scared to death, and we don't want to have to pay those outrageous fees. So that price transparency is a huge stress reliever for a lot of families too, because they know they can come in every day with us if they need to, and we're there for them.
Yeah. So it's interesting as you just explained all of that. The first thing that popped out to me in this explanation is you were able to control patient care. So you were able to make these decisions based on the fact that you had the liberty to choose what you were and were not going to do, because you were not beholden to a lot of the rules or laws or standards or whatever. And the other part of it too is the irony of the fact that people would get sick, and the first thing they were told is don't come in, don't get care. Quarantine. And as you said, people are passing away in their homes. And I never really thought about it till you said it. It makes my head explode to think, oh, you got sick. The first place you want to go to is to a doctor, right? You want to get care. You want to get healthy. And the message was, you have COVID, so don't come in. And then one of the things that I thought is really interesting, I want to move to here, because it's really kind of a key component to cash-based models, is as you mentioned, the affordability of your model. So there's disclosure on this is how much it's going to cost. And it's so weird. It's like, imagine going into an Apple store to buy a computer and not knowing how much that computer is going to be, right? And the price is always moving. And it's like, okay, so if I come in on Thursday, or I don't know what, they're like, we don't know what it's going to be, but come in and then we'll commit to buying the computer, and then we'll tell you how much it is afterwards, right? So you've got this price transparency. You've got these their monthly fees, right? So they just kind of pay a monthly retainer to have access to you. So, but it really opens the door for patients to say confidently, number one, I can budget healthcare in my life for the first time, because I'm working with a cash pay doctor with the price transparency. I know what it's going to cost. I know I have access to this person, which builds the confidence for the patients in a very interesting healthcare situation when nobody knows what anything's going to cost, and hospitals are charging $300 for a Band-Aid. So explain a little bit, how do you call it? Is it a concierge model or this cash pay system? So how does your monthly fee process work with your patients when they come in and sign up with you?
Well, a lot of people use the concierge versus the direct primary care kind of interchangeably. In my mind, and I don't know if there's any hard rule about this, but in my mind, a concierge doctor is high end. You pay high fees and have access to that doctor. It's a very limited patient panel that doctor has, and it's more just like access to your doctor. I chose the direct primary care because it's a low monthly fee, and it typically helps more people, and that was my goal, to reach as many of the families as we could. So our fee is $20 for children under 18 with a paid adult subscription. And then for 18 to 50, to 50 is $65 a month. And then 51 years and older is $80 a month. And so that just comes out automatic. We typically teach our families to do an HSA plan so that they're using their healthcare dollars tax-free. And like you said, it's just, I think people downplay how stressful healthcare pricing can be. And, the federal government did just come out with the no surprise billing bill. But it's just really interesting to me how helpful it is for people to just know they're paying this, have access to us. And I feel like I get a lot more buy-in from the patients by charging those lower fees, because some of the insurances are more or less free. Either your employer-based insurance is covered and there's no cost to the employee, or there's state and federal programs. But when we see those types of patients, typically they don't have the buy-in. It's sort of like if you pay college for your kid, a lot of times they're out partying. But if you have them put some skin in the game. So I get really great patients. They're really committed. They're compliant. They're engaged in their health. They're proactive, right? And that's why another reason we got through the pandemic so well is because we teach people how to be healthy. And sometimes our families will say it's such a weird model. Like, I'm not going to the doctor when I'm sick. I'm coming to stay healthy. So it's a whole mind shift on so many levels, but it works really well.
That is true. The maintenance model, the health maintenance model is certainly, it is a paradigm shift, because most people are like, well, there's nothing wrong with me. So until there's something wrong, I'm not going to go see the doctor. And then, of course, the costs for their care to kind of back out of that health issue that they probably could have avoided, by, maintenance, which, people in your program, your patients are incentivized to come in. They're incentivized to maintain their health because it's an affordable cost. They know what they're getting. And so it's easy for them to come in and say, I am not afraid of what this bill is going to be because I already know what it's costing me. So I'm going to come in and maintain my health. And over the long run, these patients are probably saving a whole lot of money, because now they're not just waiting for some catastrophe in their body all of a sudden to not be working. And then they're like, okay, I just spent 8 days in the hospital because I put something off because I was afraid of the sticker shock. So just for clarification reasons, a lot of your patients do have health insurance. Is that right? But there are still, even with that, they're still electing to go with your model, and because they know that they have access to a doctor at a price that they can forecast. Is that true? So do a lot of your patients have just health insurance in general and still elect to come in and do the maintenance program with you on the cash side?
Yeah, I would say probably about 40% do have insurance and 60 don't. The ones that have insurance, as we educate them on the economics of medicine, they typically choose to pay cash and not use the health insurance. And so I'll give you an example of that. Like, we've negotiated cash pay rates for x-rays with some of our local imaging centers. And an x-ray with insurance is typically around $150. Our cash pay rate is $27.
Whoa.
So, an MRI, we've negotiated cash pay for MRI without contrast is about $295 cash. And with insurance, it's usually $1,500 to $3,000. So as we educate people on how to, really be smart consumers of the healthcare system, they typically say, you know what, I'm never going to reach that deductible of $7,000 to $10,000 for my family. I don't want to pay all the co-pays, So a lot of them even go to their HR and say, I just want the catastrophic plan, or what can I get that is the highest deductible? Because I do feel you still need a catastrophic coverage of some sort, either a health share or an insurance plan for what it used to be. And it's sort of funny when I talk to my dad, he always calls it hospitalization instead of insurance. And I'm like, he's actually right. That is what it was intended for back in the day, and it did what it was supposed to do. But anymore, our front desk girl, she had United Healthcare, and she ran her hormone panel through United Healthcare. And her EOB was about $800 was what they charged for that panel. And our cash pay on that was 120. So, she's like, I'd just rather pay cash and not deal with it.
So this is, this is a direct, this is kind of a slap in the face of the healthcare model as it stands, right? So we're seeing a result here of an entrepreneurial doctor such as yourself who decided to go with cash pay. You're controlling your patient care. You're treating patients on a maintenance program rather than a catastrophe program or a catastrophic situation. So your patients are generally healthier. And then the cost, not only can they forecast their monthly expense for this care, for this maintenance care, but they also are going to save money if they need ancillary services, right? Because you've worked in the market around you to start building relationships to really not just save the patient's money, but actually do good all at the same time. Like, how many times in healthcare have you seen a situation where you can do something in healthcare, treat a patient, and at the same time, you're doing something really good for the patient rather than just trying to keep a patient alive, right? Or address the symptoms only. But it's like, hey, this is a global service. So my question is, because I'm listening to this model and I've talked to you about it multiple times, which I just think it's fascinating. I'm so glad you're on the show because I think what you're saying is some really powerful stuff. And it seems like your model to me is a no-brainer. So my question for you, and I know that you've sat on many boards across the country. I know that you have spoken from the stage. I know you've talked to doctors. So my question is why, with this model, in my mind, being multiple wins at one time, why do you think doctors aren't doing this model more often across the country? What do you think is holding back these doctors from like, man, I really want what Dr. Bishop has, but I'm not doing it because, what do you think?
I get that question often when I go to have lunch with my MD and DO friends. They kind of say, how do I get out? How do I get out of the system? Mm-hmm. And the system is broken. It's collapsing around us. I mean, everybody sees it. And I feel bad for them because a lot of them are really good doctors who are trapped in a bad system, right? And so the quick, easy answer to that is when BUCA plans come around, don't sign that contract, But then they have no idea what to do, because we became doctors because we care about health and humanity, right? We didn't, if we were all business people, we probably would have got MBAs and not went into medicine. So the business aspect of medicine is very, very interesting. And, you just have to pay attention, but I don't think they would they know how to market and how to get patients, because, if I would have contracted with Cigna and said, I'm primary care, they'd say, here's your 3,000 patient panel that we're going to assign to you as their primary care. The patient has no knowledge of who I am. I have no knowledge of them. To me, that relationship is super important. And that's why we have people come in for free consults to figure out if they're going to be a good fit both ways, right? There's patients that I say, hey, I don't think you would work well with me. We'll find you someone else too. So, I think that's one of the reasons is they just truly don't know how they would market themselves or how they would make money. And the business side is not something that most of the doctors like to sign up for. And I'll be honest, I still say the business is what brings me to my knees every day, almost, dealing with all of that. So it is a challenge. But as we're getting more and more of these direct primary care offices set up and teaching the doctors how to do it, they are coming out and doing it. The other side is a lot of them just simply can't see how charging people that little money would make any sense when they're used to getting reimbursed by insurance. And, when ICD-10 came out, the initial things, which I haven't looked in a while, but the initial studies were showing that was going to cost offices an additional about $80,000 to hire the proper coders and then the billers and then the people to sit and argue with the insurances, And so sometimes, like when I talk to my banker and stuff, they'll say like, oh, what's your AR? And I'm like 0, and they're like, you have no accounts receivable? And I said, well, no, everyone pays at time of service. So we're not floating that money 3 to 6 months to insurance companies like some of my colleagues have to when they sign those contracts. And And we don't have a room full of people, anywhere that are arguing with insurance companies, trying to make sure our chart notes are appropriate, that match the coding. We just don't deal with any of that. So we can do primary care incredibly affordable, and that's what we used to do. If you think about when my parents went to the doctor, you just paid at the time of service, right? Like it was sort of like you go to the grocery store and you pay when you take your groceries home, and so it's just bringing people back and making them think a little bit different. And the same thing with my colleagues, once they start to understand, oh, this is doable. And, we're doing remarkably well. I funded 8 residency programs now that
Wow.
I personally was able to fund by this model. And I guess I'll share too that on the patient side, they pay so little per month that the perceived value is insanely high. And so we've done some analytics and research on that, and they spend a lot more when they're in the office. So we encourage our patients to truly stay healthy to come in every 2 months at least. We don't really want to go longer than 8 months without seeing them. But every time one of our patients, our members, comes in the door, I believe we're at about $103 that they spend in office at time of service. So they're spending more on other things because the perceived value is so high. So the model works really, really well.
Yeah, so I've got 2 things that are on my mind from what you just said. And the first is the marketing side. So on the marketing side, that's probably one of the hot buttons for the doctors. And maybe because they get on these panels, because it's like, well, if I get on a panel with an insurance payer, then at least I have a flow of patients coming into me. And so at least I have a critical mass or some sort of a rotation for cash flow that provides me some feelings of security, and that I don't have to go out and market myself so much, because these panels are kind of pushing these patients to me already. But the uniqueness of your model, because it's not just another thing about your model that I love is that the culture of your practice, the culture of how you deal with the patients, but also the culture with the internal employees at your office. And so going to the marketing side of it, how have you attracted patients into the practice? Are we seeing this are you doing external marketing and pay-per-clicks, things like that? Is it really heavily referral based because people are capturing your story and telling their friends? Like, how does your marketing work right now?
So initially the practice was built solely from word of mouth. And
Okay.
it's still, that's our main referral source. We do a little bit of marketing. We stopped doing the Google ads and things because we just had no return on that. It's definitely word of mouth, speaking to people. We hired a PR firm for a little while, but that wasn't spectacular for us either. And because it is built on relationships, it's more about getting out there and just sharing what we have, and people want what we have. During the pandemic, that was another thing. I can't even tell you how many people said, I would rather die in your office than go to the hospital. So the trust in the medical system through the pandemic is just gone, and people, I refuse to go anymore. And so this type of model where we know them and they know us, and we'll get on the floor and play with kids during the day if we're doing well child checks. It's just a totally different feel. And that's, I think, what people want. The other interesting thing that came out of the pandemic is a lot of people went to telemedicine, and we gave our patients that option, and hardly anyone took that option. And I think with medicine and healthcare, we have to take care of people, and people want that human to human contact and that touch. We literally had people coming in together, husbands and wives, and they would sit we have recliners because we do nutritional IVs. They would sit in the recliners and get IVs. And I'm like, what are you guys doing? They're like, it's date night, but we can't go anywhere else in the world. Everything's closed. So we had families hanging out at our practice because we were like the only normalcy left in their life, and so we can't discredit the human to human connection that medicine is all about. No matter how much we all want to do telemedicine and, where the world's going with that, I think humans need humans. So that's my thought on that.
Well, and the whole name of the practice here, one of the key words that pops out to me with the name of your practice is the family part. So everything you're talking about right now really contributes to that culture that you're establishing with your patients. Like they feel kind of like their family in your practice, and you guys communicate a message and a culture that, hey, you are family here. You are important to us. We care about you. We know your kids' names, and now you got people showing up to get drips for date night because, yeah, as you said, there's normalcy. It's like, we feel safe here. And so we're going to do this together. And this is, I mean, that's one of the things I could feel when I walked into your office the first time was there was an essence of a very strong culture of inclusion, a strong culture of kindness. And as you know, as your name states, really a culture of like feeling like, oh my gosh, I do feel like family here. And when people see me here, they smile. They smile at me and they call me by my first name without having to look at my chart notes, you know? So one of the last questions I have for you is, for doctors that are actually watching this show today and are like, hey, this is something that I want to get into, I'm not really sure. What kind of recommendations would you give to a doctor? One of the things you mentioned is like, don't sign that panel contract. But what kind of recommendations would you say to a doctor that you're drinking a cup of coffee with? And they're like, how do I do this, Bishop? How do I do this? And you would say, what would you recommend to these doctors that want to try to make the move?
Well, definitely tap into the DPC. There's DPC Alliance. There's the DPC Frontier. We have DPC Summits. There's all kinds of resources now available for direct primary care. There's attorneys that specialize in it. There's some insurance brokers who have kind of left their traditional practice and now they're teaming up DPC clinics with different catastrophic plans. We have school districts going to this. We have municipalities that have done it because they're seeing the outcomes are so much better because, you know, healthy patients create healthy families, create healthy communities, right? And so a lot of people are starting to wake up to this model. So I think they'll be able to find some of that. They can always contact me, you know, if people are interested. I'm always willing to share sort of how I did it. I was fortunate in that there was a doctor in Kansas who I watched a video and he was saying exactly what I was saying. And so my mom said, well, fly to Kansas, you know, go meet the guy. And I'm like, well, let me try an email before I jump on a plane. And he emailed me right back and he kind of said, you know, a rising tide lifts all ships. And here's everything. Here's my contracts. Here's what I charge. Here's how I do it. Take it and run with it. And so it was pretty easy to implement. To be honest, not a lot of admin time or anything like that. So I would say definitely go for it for sure. I love it.
So you mentioned DPC extensively there. So if for those of our guests who are watching this show on YouTube or wherever we have the descriptions, I'm going to put in some of that information in the description so they can find those links easier. So you and I will work on that, Dr. Bishop, just so we can provide some value to them to start at least doing some mouse clicks into a discovery process to, you know, transform their lives. And based on everything that you're saying right now, I mean, you embody what I would consider to be freedom in healthcare. You, because of this cash pay model, the significance of the things that you do, you really do control patient care. And that whole maintenance model where people, because they know what they're going to pay, come in and get regular checkups and maintain that health, they live happier lives, like that whole domino effect that you mentioned. Again, it just keeps going back to this no-brainer that like this is the way healthcare kind of was, as you described, with your experience when you were young, and then it kind of got wacky. But there is a possibility that doctors can still control patient care, and they can still take back, you know, not just the control, the cash, but you know, also bring back some of the joy of actually being a doctor instead of feeling like a caged animal and I'm being dictated by the insurance payers and the corporate structure of healthcare to the point where I just kind of walk around and do what I'm told to do and see patients that I have no connection with because that's how it works. And I think a lot of doctors probably would be very interested in, not just being a doctor, but also love being a doctor again. And maybe they've lost that, but that's the one thing I saw with your practice and the way you are with your team and with your patients, that there is still a very strong nurturing aspect to what you do. And going back to that family thing, I'm going to beat this horse to death on the family side of it. But so yeah, I will go ahead and put the links for the DNC in the description for this show, so doctors can start clicking. You kind of mentioned this already, but possibly if doctors had any questions, they can visit keystonemedicine.com and maybe pull on your ear a little bit on a few things if and when you have time, because I know you are very busy, not just in medicine, but because you are this entrepreneur. I know you like to put your fingers in pies, right? So,
unfortunately, yes, I do.
That's all right. Well, we need people like you being active and sharing the message and kind of sharing the gospel of controlling patient care and maintaining that independence and thriving and creating an environment that's a win-win-win-win for everybody, which is why I wanted you on the show. So before we go, is there anything that you want to say to the audience before we wrap up?
Not really. Just keep doing good work out there. Yeah. I mean, I love our doctors. A lot of times people are like, oh, the MDs. And I'm like, guys, it's not the doctors. It's the system they're stuck in, So to all of our healthcare providers, especially you guys that are in the hospital systems and things, I have utmost respect for you, especially after the past 2 years. I don't want to make it sound calloused or that I don't respect you guys, because I took care of a lot of our healthcare providers from hospital systems through the pandemic, and it was incredibly stressful, and they were put into situations that, a lot of people would have broke from. So, I have a ton of respect for them, and happy to help any way I can.
Very good. And one of the cool things I do want to mention about Dr. Bishop is she's actually a member of Health Professionals Alliance with myself and a lot of doctors across the country, because we are looking to protect our independence and we're looking for ways to continue to grow. And we believe it's not too late. We think that we can change the tide in healthcare. One of the questions I always ask doctors is, what is healthcare? Right? And that's kind of a big question. And typically we get very technical answers of what healthcare is. But my definition of healthcare is simply this. It's when a doctor sees a patient. That's healthcare. Nothing else happens until a patient sees a doctor. And I don't think doctors understand how much influence they have over the market still. But you are this ray of sunshine and hope that I'm really excited to have had you on the show. And again, our message to doctors is we want to help you stay independent. We don't want to see you consolidated. Go to hpamembers.com, check us out, find out what we're doing. We are trying to create a national movement across the country to help doctors stay independent and collaborate with each other to pull our good ideas together to help support each other, control that patient care, thrive in the market, and build your wealth. Well, I really appreciate your time, Dr. Bishop. Thank you for being on the show.
Absolutely.
I've been anticipating this for months.
It's always fun to hang out with you, Grant.
I know. And next time I'm in town, we'll getting
do it
together.
again. All right. Perfect.
All right. Well, I appreciate your time. And that sums up this show, Real Docs, where we talk with real doctors, we cover real topics, and we spotlight real solutions. That's it for today. Have a great one.